Hindi.
1 second, let me minimize my screen here. Oh, Lord. I'm going to be introducing a former colleague of mine from the St.Martin Medical Center. We did not work in the same department. I was in the emergency room and she was in the X-ray as a radiodiagnostic technician. She is an amazing colleague, very qualified, dedicated, knowledgeable, knows all the machines that have to do with imagery and diagnostics. And so I thought she would be the ideal person to come and give a presentation because we almost always have a doctor or a nurse, but it's also good to have a different type of healthcare provider give their perspective on an aspect of healthcare. They are equally qualified to talk about this. And a lot of people have questions about mammographs and the whole breast screening process. So I would like to introduce to you Miss Antoinette Pourier, who is a radiodiagnostic technician in the radiology department. She was born in Curacao, but she went to high school here actually in MPC, and she studied in the Netherlands. And she came back here and is now a radio technician. And she loves to work with patients and help doctors come to a proper diagnosis. And making people feel comfortable going through procedures is something really, really important part of her task. And she had a quote that she would like me to read for you all. It states, "Knowledge does not produce wisdom. Transforming knowledge into wisdom requires input from the heart. The task of education must be fundamentally to ensure the knowledge serves to further the cause of human happiness and peace." And these are words of wisdom, Buddhist inspiration for daily living by Daisaku Ikeda. Did I do that right, Antoinette?
Perfect.
All right. I am going to share the screen, so give me 1 minute here. Whoops, I did it wrong. I'm a co-host, right, Dolly?
Yes.
Okay.
We could skip that one because you just said the same thing already.
Okay.
Just go to
No. Okay.
uh, the next slide, please. Thank you. Good evening, everyone. Thank you for the invitation.
Hello?
First of all, you can hear me?
Hello?
Can
Am
you
I?
hear me?
Okay,
Yes.
I can hear you. I'm sometimes my internet is unstable, so I can
Okay.
hear you.
Everybody else could hear me, right?
Yes.
Okay, thank you. Good evening, everyone. I would like to give my thank you to the Mali for the invitation and to you all for giving me the opportunity to speak a little bit about my part of the X-ray department. Due to the fact that it's October, and so we choose the mammogram topic, and I wanted to explain a little bit out of my point of view, things that I come across when patients have to come for mammogram, or the knowledge a little bit to horizon their knowledge a little bit more about the mammogram. So at the moment we have a new machine, so it's the process of using mammogram in general is a process of using low energy to examine, to detect and evaluate any breast changes. There are two types of mammogram, a diagnostic one and a screening one. And the goal of mammogram is to the early detection of the breast cancer, typically through detection of characteristic masses of microcalcification. I will explain that a little bit more in the diagnostic part, or if you have more questions about it, I could explain it a little bit more about those 2 points. Can you go to the next slide for me, please? Damali?
I'm trying.
I know, no, I'm just, I know you look like you froze. That's why, sorry.
Yeah, I think I did freeze. I'm hitting next. Hmm, hold on a second. Let's try. Mike. Okay. I'm pressing every single button and nothing's happening. Are you all hearing me?
Yes, I could hear you. The rest I
Yes,
think is on mute.
yes, we can hear you.
Okay. My computer seems to have frozen. Forgive me for the technical difficulties here. I don't know what's going on.
It's part of the process. Nothing happens for no reason.
I'm just roll with it, right?
Yeah.
Okay. My computer is totally frozen.
And I don't. I try many ways to.
I'm going to try it again. Give me a second. I'm going to have to do it this way.
It's okay.
Yeah?
I have no problem as long they could see and I could say, I'm already pleased that you're helping me out.
Okay. We got it. Mm-hmm.
And then we go to the next slide if it goes. Okay.
Mammogram machine. Mhm.
No, the one before, the explanation of the two types of mammogram. Like I said before, we have two type of mammogram, the screening and the diagnostic. Screening is just like a normal checkup, your a mammogram of the breast for who have no sign, no symptoms, a normal routine. And diagnostic is a mammogram of the breast for women who with have abnormal findings like a nipple discharge, breast coloration, any abnormal things that they normally not aware a customer see on the breast, that fall under diagnostic. Next, please. This is now showing the new type of machine that we have at the moment. It's a modern mammography machine. It's safer and expose the breast to less radiation possible. It's designed to only look at the breast tissue itself, and it have the ability to do a 3D mammography. So while you're standing, do a normal mammogram, we have the ability to look at the breast in different angles and kind of scroll through the breast and see any differences between the previous mammograms. Um, Next one, please. This is a little short information I want to explain about the anatomy of the breast, what we as X-ray technicians look at. We pay attention to the nipple, the areola, um, the main pectoral muscles as the main chest muscle. We pay attention as well and at the fatty tissue, even though it's on the inside. We see how the breast, it's how the breast looks. Those are the things that we look at when a patient stand in front of us as technicians. The next slide for me, please. Not recommended for mammogram. These are the things that we try of hope that not happens. That of the day of the exam itself, do not wear deodorant, uh, talcum powder, or lotion under your arms or on your breast. These can appear on mammogram as calcium spots. If a patient does come in with these with excessive deodorant or powder, we ask them to remove it. And during and around menstrual cycle, it's best not to do mammogram if your breasts are tender and very sensitive. And most of the times, we also recommend, say if the appointment's already made and you did get it's your menstrual cycle, just call and reschedule. It's not a problem. Or if you're not a type of person who have very sensitive breasts, even though it's your menstrual cycle, you could still come. But it's up to you. We give you the option. The next slide for me, please. I decided to speak more about the procedure when a patient come inside, so they have an idea what all we do ask. So by entering by the room, certain questions we ask: do you have family history? Does breast cancer come for in your family? Is this a normal routine or screening? Do you feel a lump or you have pain? We ask, can you show us? So we have an idea where is it located for the doctor when they ask us questions. Do you have implants? Does also have to do with what type of procedure we will do, more technical wise, or if you had surgery before, removing a cyst or breast reduction, because all of those things we do see them on the mammogram, so then we know in advance, hey, you had this in this surgery before, this is what happened. Next slide for me, please. The two main positioning of the mammogram. Rotate the head away from the breast, be an exam, that the patient lean a little bit forward towards the machine. Pull of moved. So when a patient come inside by me, I'm going to explain what I explain to the patient, much understandable. So we start with the right breast, if the patient didn't have a surgery for. So we start with the right breast to do a mammogram from top to bottom. On the picture says CC, that's the medical term for it. We move the hair out to the side. If the patient have a necklace, we take it off. If they have dangling earrings, we remove that as well, because none of those things we want to be a disturbance on the X-ray picture, because all of those have how you say it? They have they contribute also on the mammogram. Then the doctor will think something is happening while that's not the case. So the patient will stand in front of the machine. We will rotate the head away from the breast vein exam. Then what I do is lean the patient a little bit towards the machine and put the plate and the breast on the same height. When the height and the breast is the same level, then I reposition the breast better on the plate and gently start doing the compression of the breast. When I finish do the compression of the breast, I'll do the same thing with the left side. So we start first with the top to bottom. And after that we finish, then we go to the next slide, please. Is the angulation view, we call it the MLO view, is optimal visualization of the entire breast, including the chest muscle, the pectoral muscle, rotation of the mammogram at a 45 degrees, because we want to get the muscles from under the armpit area. Place the hands on the handle as the armpit is placed over the corner of the bucky. That's the plate of the machine. The arm should be resting over and on the backside of the bucky. So then we're trying to get the arm as more relaxed as possible, so your muscle from under your armpit as well could be relaxed. Once sure that there's adequate axillary tissue, position and apply the compression while supporting the inferior aspect. So while I see that the patient relaxes the arm, then I'll start doing the compression, because when the muscle is tense, the patient might feel a little bit soreness, or let's say sensitive part being squeezed. And the breast needs to be pulled up, like under your armpit area and out. so that it will image as a 90 degrees to the chest wall. So that's the motions that we do when we're doing the angulation picture. So we have two different views. So the doctor have two different types of way to look at the breast, the front to the back and the sideways, so they could see and make a better diagnosis. Because one view, you cannot say much what you're seeing and in which depth it is in the breast. Next slide, please. Breast compression is necessary to even out the breast thickness so that all of the tissue can be visualized. Spread out the tissue so the small abnormalities are less likely to be hidden by overlaying breast tissue. Hold the breast still in order to minimize blurring of the image caused by motion. You will feel pressure on the breast as it is squeezed by a compression paddle. It is sensitive for most women, but it shouldn't be painful that you not can handle. I ask in between, how do you feel, to reach to my goal, but also keep you in mind, because end of the day is your breast being compressed. So I need to know to which extent I could go and do a good image for the doctor, but not hurting you. The next slide, please. I call this the general information. Calcification are visualized on a mammogram, which are not visible on ultrasound. A lot of patients do not like mammogram, so they ask the doctor for ultrasound. But ultrasound is only an additional procedure. It's not for screening, so we will miss information. Calcification, you can only see it on mammogram, and calcification is could be a beginning of a cancer. So it's a must that a mammogram, and as second, we will do an ultrasound as additional. Before, there used to be the age of 35 and up that we start doing mammogram. Due to the fact that the cancer started early age, their institute changed it to mammogram could start for the age of 30. And this is a question that I've always been asked. How much times do I have to come? Every 2 years, mammogram is being recommended, but end of the day is you making the decision. Women with family history or herself a woman with cancer, they come annually. They come every year to do a checkup. But those persons who just come for a screening, a normal checkup, most come every 2 years. Some come when it's time, they think it's been so long, it's time to come back to do a mammogram. Next one, please. Now, I reached 2 questions. And the last slide is just what you wrote, the quote. I had to just have it in the background. I don't know if there's any questions or anything that I should explain a little much in detail for you, coming from a radiodiagnostic technician point of view. Because end of the day, I'm not a doctor, but I do this on a regular basis. So I know what the doctors kind of would like us to do to give them a good image so they could give a proper diagnosis.
Well, may I start? I just want to thank you for your presentation. And the question I was going to ask, you answered it, which was the ultrasound thing. Now, I just had the opposite opinion. I used to insist on ultrasound, not realizing it's an addition to the mammogram. So now I have an explanation.
Yeah, because it's something that comes every day. Because most patients, when they go to the house doctor, like, no, I don't want to do mammogram, it hurts. I understand. It's not a very fantastic feeling that you want to go through. It's because if you're a person who have very sensitive breast and it being compressed, it's feeling extra sensitive already. So, but if the doctors just do ultrasound, we might miss information. So most of the time when you do come, we do ask the radiologist what it is that they want. Sometimes the patient like, no, I just want ultrasound. We go ahead and plan it, but we just tell you, okay, ma'am, I do plan it, but no, the one that you come in front of the radiologist, he have a different meaning, because end of the day is he's have to make a report, and if he have to make a report, he want to give a proper diagnosis for you to send to your house doctor. So we do mammogram first, and if you feel something or you have breast implants, those are things that most of the times we plan them one time, mammogram and ultrasound, because if you have breast implants, the procedure goes the same way. It only is we focusing on the tissue, yes, but we gotta make sure that we don't compress too much that the implants get damaged. So and then the ultrasound follow, so they could see especially under the armpit to see everything is good there, with the lymph and everything. But ultrasound could clarify, is this more what we see in the mammogram? Okay, no ma'am, this is a benign. No ma'am, this look a little bit suspicion. Let me do the next step. Should we do a biopsy to send a piece of sample away, so we have to make sure what it is. So those are things that we do, but ultrasound, we only do it by young children, let's say to before the age of 30, because the breasts are very dense, so it's very white when you look at a mammogram. So those are the people that we do ultrasound. But as long as you're young and you feel something, you could be 16. If you feel something, we have to do a mammogram to make sure what it is that we're seeing.
Thank you, Antoinette. I appreciate you doing this for us, giving this information. I thought it was handy for people to understand the procedure of the mammogram, because it's for a lot of people who have never gone through it. They don't really understand. Everybody knows your breast gets compressed, how it actually, what the procedure is, what is asked. I learned today why it was so important not to wear deodorant. I didn't even know that, and I'm a healthcare professional. I didn't know that the deodorant, the powder, shows up as calcium deposits on the breast. It actually makes sense when I think about it, but I was not aware of that. So that was good to know. My mother had breast cancer. That's the secret. And her it was malignant, but it was not visible on the mammogram. She happened to have dense breast, and her oh my God, I can't think of the word, but the lump was not detected by mammogram. It was detected by ultrasound. So if you have dense breast, the ultrasound is an addition, like she says, and I'll have to convince my mother that she still have to get a mammogram. She's like, no, I want to have the ultrasound. No, you need to do both. You do both.
Yes, because when breasts are dense, but with this new new machine that we have, we don't ask the doctors, doc, this patient have a dense breast. Do you want me to just do a normal mammogram, the front to back, or do you want me to do the 3D, which is look the breast in different angles, and then afterwards they could scroll through it and see better, okay, through the dents. Then the patient don't necessarily have to do the ultrasound, but like I said, it's a new machine. The doctors are still adjusting to what they know to what what we're getting right now. But when it comes to dense breast, yes, ultrasound is a must, because the mammogram, you see it dense, you can make sure, okay, there's nothing, but with an ultrasound, you could go ahead and check, okay, ma'am, no, I'm not seeing anything out of the ordinary, it's just dense breast. Or you have maybe
and what, can you explain what it is you see? Because you said dense breast shows up very white. Why is that? And what there's white, and then there's white, and there's
normally, like when you look at the anatomy, you have the ductus, and you have the lobulus, and if you feel, the ladies, if you feel yourself, you feel like it's very lumpy.
Yeah.
So when your breast is compact, like young age, you don't have much fatty tissue. So with time, with years, you have more fatty tissue. So when I compress the breast kind of spread out, and you can look better through it. But because young persons, okay, even though it's your mom, she's not young, but she's the type of person who does still have a breast like a younger version. That's why it's still dense. All you see mostly on the X-ray is white. So you see the blackness of where the fatty tissue is, and then where your ductus are and your lobulus, it looks very white. Those are the knobs that you feel in your breast. It's very white, white. So white on the image. At that part, I can explain, but that's how we do see it on the mammogram. But due to the fact that
the ductus, for people who don't know what a ductus is, the ductus is the part of the breast where the milk comes down to when you want to breastfeed. So there's fatty tissue, and in between fatty tissue, there are these channels through the breast that let the milk pass through into the nipple so the child can get the milk. So a ductus is that channel, multiple channels where the milk flows through to the nipple area.
The waist, yes. And then around the ductus, which is the waist for the milk, you have what we call on the picture, the lobulus is like hoe zeg ik klieren? It feel like they're not lumps, but it feel like lumps because that's how it looks. It's like a tree area. That's how our breasts are look from inside. So those on the X-ray looks white when we do the mammogram, because remember we given low doses. All we need to see is through the breast tissue to make sure everything is the way it should looks.
And another question, women who have implants, you can have implants under the chest muscle, but you can also have it directly in the breast itself. Is it under the muscle? I'm assuming that wouldn't really have a problem, but if it's in the old-fashioned procedure where it's under the breast tissue, that would call for something different, right?
Even though where the position of the implant
prosthetic
is,
the
way we do the X-ray for the mammogram, that remains the same. That's why those patients have right after do an ultrasound, so the doctor could see, okay, the breast tissue that is still seen looks okay, and where the implants are, whether it's behind your main muscle or in the breast tissue itself, that everything around this looks good, that there's no leakage of the implants, because the implants could have a tear. We might not see it, but with the ultrasound we could catch that to help them on the early stage, because you don't want it to bust.
Leaking implants. Oh, and just you're talking about bust, can you please assure them that the compression of the breast in the test does not bust the implant? It probably had a tear.
No. It doesn't break, because we're not even though we do the same procedure, but there's to a level that we are allowed to go when it comes to breast implants. I'm gonna give an example. When you come with no implants, we're supposed to give you between let's say 7 pressure to 10 or more, depends what a patient could take. Because when you reach 7, the machine could have a good reading of the breast. But for implants example, I can't give 7 because it's implants, so it's less. So when you come in the room, we ask, ma'am, even though I went and look at your old picture, things does change. Do you have implants or do your own breast? And that helps as well for us to change the
settings,
the type of radiation that we give. Is it normal, or we have to give a little bit to pass through the implants to look better at the tissues? So all of those play a role, but we don't squeeze to kill. It don't burst. You're not allowed to pass a certain amount. Any other questions? Or was it understandable clearly?
Glenda, go ahead.
Yes, I don't have a question, but just to say that I appreciate knowing about the deodorant part. At least it will prepare me for my next mammogram, because I never knew that. And well, maybe just a question. I never had the question asked to me whether I had implants or not, but I guess maybe the doctor can look at your breast and know right away if you have implants or not, right? And then
If
choose to
you
ask the question. Because
no, if
I
you
don't have implants, but I've never been asked that question.
question, because what happens, like I said, let's say for instance, this week is my week to do. Anybody who is planning to do mammogram, we do all is for me. But before I go to the room and call your name, I go look into your previous picture. So if you're not being asked because they saw in your previous picture, you didn't have implants. But even though you came last year, a lot could happen in a year. I still ask you, do you have implants? Because maybe you just get up and say, this year I'm getting it. So I don't assume, I ask just to be on the safe side, even though I saw all your previous pictures that you did not have it, but a lot of things could change. So I do ask, do you have implants or not?
Okay.
She never
Thank
met
you.
you, Antoinette.
Sorry?
She never met you. She met your colleagues.
Yeah, I do.
Oh, you know,
I kind of make.
Damali, and that's another thing. When women go to have their mammogram done, shouldn't it be a lady instead of a male? Because I felt so uncomfortable the last time I did mine.
Honestly, Ms. Glenda, it's only since I'm here in SMMC Hospital, I do mammogram. See, our hospital here is very small. Imagine, it's only women. I would say I will not come to work because every day, every week, doing mammogram, that is boring. Sorry to say, but it's boring. And we rotate. So like this whole week is mine. So like today I had 5, but tomorrow I already know because I prepare myself mentally when I do mammogram. Tomorrow I have 6. The day after I have 7. Yes, because mammograms, end of the day, it's not my breast being compressed, but I understand that women do not like the procedure. I try to make it as comfortable as possible. I talk to them. I make jokes. I make them feel at ease that even though it's the first time, I'm like, okay, was it that bad? I mean, it could be bad, but was it that bad? No. And I always tell them, please do not tell my colleagues how I do mammogram because I do it differently. I mean, we do have the same results, but I do it differently because I pay attention to you as well, not only what is supposed to be done. So I'm trying to combine your feelings and what I need to do to get a good diagnosis still, but just to have it in between in balance, because I'm ready to do this. And I'm
that's
not that
very
type
good.
of person. I go in stages to ask you in between how you feeling. And when you tell me, no, it's too painful. And when I pay attention, like, okay, miss, I really need to do a little bit more. Do you think you could bear with me a little bit? And I ask you to, give a little bit, inhale and exhale sometimes to calm yourself. And then I could continue and then just one quick and press the button so it could release. So it's about the person as well, I think. But like I said, it's only since I'm working here, I'm doing mammogram. Let's say from 2017, I'm just doing mammogram. 2016, I was taught. I mean, I learned it, but I choose not. But from 2017, I'm really on the floor, helping with every part of the department because they want us to be, we're not a big group. The radiology in St. Martin is not a big group that you could say, I ain't doing mammogram, I'm just doing the rest. It's not possible. So we have to rotate. So the men, them, unfortunately for them, fantastically for me.
I hope I get you on my next appointment.
When is your next appointment?
I still have to schedule.
Okay. Right now I'm off. The next 2 weeks are coming, and I'm not on I'm not there because sometimes patient like, can I have the same lady? I say, okay, you can ask, but don't ask all the time because then they're gonna say, what do you do that we don't do? And in November I don't do much. I'm off as well from like around the 15th. So if we come before and maybe I could assist. Try most of the time.
And just to speak to to speak to the concern that Glenda actually had, is that having a man handle her breast.
True.
From a healthcare perspective, all healthcare professionals don't see you as a sexual being when you're in front of
No,
them.
they see
It's
as a
more your own interpretation, and of course your own not insecurity, but your self-consciousness, to put it that way. But a lot of gynecologists are men too, and you have no choice but to go to a gynecologist as well, which is even more intimate than
I would
handling your
choose
breast.
to go by gentleman faster than a lady. Don't know why.
People assume that women are automatically much more gentle, and that is actually not
Not
the
true.
case.
Not always
Not
the case.
true.
Okay. I'm not saying I'm not, but I am. But it's not
Don't
always the
assume.
case. No, exactly.
A man as a healthcare provider is just as professional as a woman, and will treat you with the most respect. So don't worry about it.
Yep.
Now you have insider information.
Yeah.
Any other questions? Antoine, thank you so much for your presentation. It was
My pleasure. My pleasure. My pleasure.
yeah, sometimes you don't realize how much goes into it. So it was really nice to find out everything.
My pleasure. Anytime.